I do a lot of physical exams in the office and in the immediate care centers. One of my common questions is, what kind of supplements do you take? Because I think it's important. It's a hobby of mine to kind of give guidance to people who take supplements, and also I think it's important because a lot of supplements can cause side effects, and they also reveal to me what some patients are trying to fight. So in the world of the gym or exercise or bodybuilding, young guys usually take creatine to get big. It's a common misconception that taking creatine will get you big muscle. It won't. But let's first talk about how to use this stuff. You get gains. It's usually volume of exercise. And with volume of more intense exercise, you might be able to get bigger muscle in the long run because you're doing more effort. You're putting more work in. You're lifting more load. And with breakdown of tissue, you'll have buildup of more tissue. The problem is, I think the false sense of security comes when people take creatine. There will be, when you first started out, a water intake that also goes straight to the muscle. So you get this false sense of being big. That's a different size gain than muscle. Having muscle that's been worked and getting large is different from edema. When you take creatine, it's a solute, like sugar in coffee. And when you have the solute, which is creatine, go into the skeletal muscle cell, it'll also pull in a lot of water. When you pull a lot of water into a sponge like a muscle, it'll get big. But that water will sooner or later leave the muscle once the creatine is done. So that's a false sense of security I think a lot of people get from creatine use. It's used to increase the amount of ATP. If you remember grade school science, ATP is what a muscle needs for energy. Muscle has to contract by pulling these fibrils together, these muscle fibers together, actin and myosin, and the only way it could do that is with ATP. Once the ATP gets used up, body has to replenish it. If you have a lot of phosphocreatine in the skeletal muscle, it'll replenish it fast. The body makes its own creatine. It's about 2 grams a day, but it sometimes would be nice to have extra amounts around. You can get that in fish and meat. Jay Hoffman, one of the exercise physiologists at University of Central Florida, where I used to be the team doctor, he was a professional football player, and he said he would always get his creatine back in the day by eating 5 steaks a day. I always wondered what his cholesterol would be at that point, but 5 steaks a day is a little bit pricey, and you can see Jay talk about it in some of his videos. It's much easier to get it in a capsule form. And there is benefit to using this stuff, but I'll get to that in a second. The capsule forms, if you're going to use them, usually the best way is to load up with 20 to 25 grams of creatine every day for about 5 to 7 days. That's definitely an overload, but it will get you to muscle levels that are high. After the 5 to 7 days, it's not worth continuing, because then the studies have shown that the urine or the kidneys just pee off the extra. So usually what the objective is to maintain on 3 to 5 grams a day for about 10 weeks max. There was one study that showed if you continued for 10 weeks, you have the benefits of increasing the ATP in the muscle, so you have an increased volume of exercise. After that, usually the suggestion is you taper off and you clean out the muscle. Now, tapering off means you just stop it. The muscle will kind of gain its own level of creatine again in about 4 weeks, and then if you wanted to go with another round, then you go at that point in time. No one ever gets to the point where they stop creatine suddenly and all the creatine drops out of the body because they forgot to make it. The body will make it up all the time. It's just if you have extra creatine around, it sometimes increases the potential. If you're doing intense exercise, it increases the potential to perform better. It doesn't help in the studies that show its use during endurance sports, and it won't help in the typical exercises you see at Planet Fitness or at the gym. I'm talking about when you do a set of exercises, 7 to 12 reps, and you rest. And you do another set of exercises, then you rest. And that kind of exercise where you just rest between sets or you look in the mirror, or you talk to your friends. You don't need that. If I can do high intense training at 51, 52, then my young guys can definitely do better than I see them doing in the current gym. You just might need some guidance from either physical therapy, exercise physiology, or somebody that's very gifted with knowledge of exercise. So if you're going to be doing intense exercise, benefit is here, so take it. I would always say you max out at the 10-week mark, which is usually what the studies show. The maxing out is when you get to a point where you've pushed to the ultimate level of what you can push with weight, like bench pressing, powerlifting, squatting, or you get to your competition of whatever you were training for. If you can get to that point, you stop, you get your gains, and you go. You just take that 4-week break, and then you continue on with either reloading or reattempting another max some other time. But I would not just take it on a daily basis because you think it makes you gain size. I think you're going down the wrong road. There's other things I think you could invest in, like an exercise physiologist or a physical therapist. And the beauty of a physical therapist, if you have one that's well gifted with background in exercise of what you like, whether it's biking, running, powerlifting, certain sports, martial arts. If you get to a physical therapist, they can get covered under your medical insurance. They can hopefully design something that the both of you can come up with safely under scrutiny of somebody who's a healer. So that's the benefit there. If you're not sure, then going through YouTube and watching videos is kind of dangerous. Jumping straight into a mixed martial arts program that you see on TV or it's advertised late at night, it's also dangerous. And again, you have to set your goals and know what your goals are. Sleep is very important. Eating is very important. Sometimes if you can't take in the creatine in your normal fish and meat products, then you have to be on creatine. But taking it with caffeine, taking it with branched chain amino acids, it's totally up to you. When you start to throw in some creatine forms that have the other components in them, if you have a side effect, you're not going to know which one of those components is causing the side effect. So it makes it a little tougher. So I like to have my guys just use pure creatine if you're going to try it. And do it the way I mentioned. Load up for 5 to 7 days and then continue on. There is one other way. You can actually do 3 to 5 grams every day for 28 days. Then you start your 10-week workout, because the low and slow load versus the heavy load over 5 to 7 days, the outcome is the same. You reach your maximum at a certain time. You also have to be wary about where you buy your creatine from. ConsumerLabs.com will have some nice reviews, independent reviews of different companies if they actually have the product that's on the label in the pill. So hit that website every once in a while if you're unsure about what you want to buy. Don't forget about the sleep. It's very important. Seek out help if you haven't from either physical therapy, exercise physiology, or even a registered dietitian. That would be helpful as well. If you're going to push the envelope with peaking out or getting to your maximum effort at the 10-week mark, you also want to be having the nutrition that'll get you there instead of hitting the wall. Fluid, very important, especially if you're going to be using the creatine. As I mentioned, the first 3 days of creatine use, because of that heavy solute being distributed in the muscle, skeletal muscle, it will pull a lot of water with it. But then it'll make you pee it all off. So you want to be making sure that your hydration state is proper. If you hurt yourself, you're just going to set yourself back, and then you're not going to know what worked, and you might be discouraged. So do this properly. Try to save some money. Try to have a goal that's reasonable and get the help that you need to get to that goal.